25 people died at the Ballyknoe nursing home in Whites Cross, Cork in January and February. The death toll is one of the highest in the country since the pandemic started. This morning, the Irish Examiner tells us that 5 of the families are seeking a group inquest. These relatives are deeply unhappy with the way both they and their loved ones were treated and have many questions that demand answers. These include: why was a relative told that a loved one had COVID when they didn't? Why was a relative told that a loved one didn't have COVID when they did? Why was a relative told that a loved one was doing fine and had just been out for a short walk when the resident in question was wheelchair-bound and hadn't walked in years? Why were relatives moved from rooms they had lived in for years? Why was a promise of daily communication not honoured? Is it acceptable that relatives be left uninformed for days on end in the middle of a COVID outbreak? That phones are left unattended for 6 or 7 hours at a stretch? Is it credible that residents received world-class healthcare in a home where communications were worse than what you would expect in a banana republic? Now, the Irish Nurses and Midwives Organisation told the Oireachtas Special Committee on COVID-19 last summer that the nursing home system had buckled for a variety of reasons, which included the following: competition between clinical governance and financial constraints, outsourcing of 80% of care delivery from the public sector, the emerging trend of corporate and international financial institutions taking ownership of large parts of the sector. The Ballyknoe nursing home was taken over by the French investment fund Infravia in 2017. Infravia owned the Mater private hospital, all of the telecom masts on Cuilcha land. They own the stadium at Olympique Marseille. They have interest in the expansion of the metro in Malaga, etc. Infravia don't specialise in nursing homes, they specialise in the maximisation of profit. Was profit maximisation a factor in the tragedy that unfolded at Ballyknoe? Many relatives seem to think so. In particular, they point to the question of staffing levels, which they believe were not what they could or should have been. There must be answers for these relatives. HIQA have carried out a recent inspection, Taoiseach. Will you join with me in calling on HIQA to interview the relatives as part of this process? Will you ask Minister Donnelly to instruct either HIQA or the HSPC to carry out a full investigation here, which goes beyond a run-of-the-mill inspection? And in conclusion, given the number of both relatives and staff throughout the country who have questions and criticisms similar to those of the Ballyknoe residents, will you support the Oireachtas Special Committee on COVID-19's key recommendation that there be a public inquiry into nursing home deaths and the pandemic, an inquiry which deals with the immediate issues raised by relatives and staff, but also the broader question of whether our society can afford to continue, I'll finish with this sentence, with the nursing home system run in the interests of shareholders and the maximisation of profit.
Thank you very much, Deputy. Taoiseach, please.
Well, first of all, thank the Deputy for raising the issue, and my sincere condolences to the families of all those bereaved at Ballyknoe Nursing Home. And the particular outbreak that the Deputy is referring to, I understand, commenced on the 8th of January, which resulted in all, I understand, 47 residents, I'm told, and staff, 49 staff testing positive for COVID-19, and tragically 21 residents died associated with the outbreak. And Ballyknoe Nursing Home, is, as the Deputy has said, is one of a chain of nursing homes owned by the Care Choice Group. And in line with the national protocol, an outbreak management team is convened by the Director of Public Health by the Director of Public Health for such outbreaks, and they work with the COVID response team to support private nursing homes during an outbreak through the provision of a range of supports. HIQA have been engaging regularly with the provider prior to and since they were notified of the outbreak on the 9th of January. It's understood that the provider did not request any additional support or ask for any issues to be escalated. And as you say, following receipt of the statutory notification of 14 deaths between the 7th and 9th of February, HIQA carried out a risk inspection on the 11th of February. And its inspectors review the arrangements in place for visiting, as well as records held in relation to visiting and family engagements. The Chief Inspector will prepare an inspection report now, outlining its findings, and this report then will be published when the full process concludes. Now, it can take some time for that process, And I will speak to the Minister for Health in relation to this, because I do take your point that the relatives are anxious for engagement here and for answers in relation to the issues that you have raised. Particularly, relatives have raised issues about limited visiting access, poor communications with staff at the nursing home, and there are a number of issues that have been raised which do deserve full and comprehensive answers. More generally, in the context of COVID-19, very, very significant supports have been provided by the state during the crisis in relation to nursing homes. About 90-odd million provided last year through the TAPS scheme, which that was made available in 2020, which provides a range of supports from PPE, infection prevention, controlled supports, training and financial support to the nursing home sector. And there's about 23 COVID-19 response teams now that have been put in place. 42 million is currently available in 2021. Of course, that will be increased if necessary.
Thank you, Taoiseach.
And on the broader issue, I've already said, yes, when COVID is over, or when we emerge from COVID, that we should have a full evaluation.
Thank you very much. Time is up.
Not just learn the lessons, but understand, particularly in the context of nursing homes.
Thank you, Taoiseach. The time is up.
What happened and how we can improve in terms of the design of care for the elderly into the future. It's not as simple as you
Time is up, Taoiseach. Thank you very much. Deputy Barry.
Taoiseach, I believe that there should be a fully qualified social worker allocated to every nursing home in this country for the duration of the pandemic. Will you support that call, yes or no? Such a social worker could act as a liaison officer with relatives, ensuring regular professional contact and arranging compassionate visits. They would also act as a valuable pair of eyes and ears, observing what happens in these institutions behind closed doors. It is completely unacceptable what happened in Ballyknoe, where relatives were not communicated with on a daily basis, were not communicated with for days on end, and who spent 5, 6, 7 hours ringing the telephone in order to find out what the story was with their loved one. There's a simple proposal. Will you support it? And in conclusion, it's not enough to say that we'll assess the situation when COVID is over. There is a need for a public inquiry which deals not just with the immediate issues raised by relatives and staff, but also the question of should we continue to have a nursing home system which is run on a for-profit model.
Thank you very much, Deputy. We move now to Deputy Dennis Naughton and the regional group.
I think I'm entitled to a minute reply.
Oh, sorry, Taoiseach. Mea culpa.
I think first of all, there's no excuse for poor communications between a nursing home provider, nursing home management and staff, and the relatives of residents. No excuse for that. That should be an obligation of the provider. The provider should ensure that that communication is there, and the part of the HIQA inspection framework will encompass that aspect of this and that dimension of that. And I think that is important, and we need answers in relation to the specifics here in this case. I think we need to evaluate how the nation responded to the pandemic. I think your point about private sector provision and public sector provision in healthcare and in elderly care is a separate issue. Actually, you can certainly derive lessons from it, and you can learnings from it in the context of COVID. But it's a much bigger issue as well, and we shouldn't pretend that it isn't in terms of the broader financing of healthcare into the future, particularly with the demographics as they change. There will be an enormous bill for the state into the future. It's necessary.
Thank you very much.
But how you actually organise and fund and provide for that is a huge question in itself, and perhaps needs a separate exercise that could be collectively engaged in by the Oireachtas.